So you want to know what the benefits of digital health are? Well, in this video, we'll go over all the benefits of digital health and how it can reimagine healthcare access and delivery. Welcome to HEALTHdrum. I'm Dr. Bert Vorstman, a urological surgeon and former researcher, and this channel is all about routine medical conditions, self-care, and digital health so you can be informed and in control of your healthcare needs. If this is your first time on the channel and you want to know all about good health, then go ahead and subscribe below. Like you, many are also interested in digital health, so feel free to reach out with an email or hit the comment section below. By the way, HEALTHdrum is for educational and informational purposes only and not a substitute for professional medical advice. The links to the disclaimer and the material in this video are in the description below. Okay, so let's get into it and start with a summary of what this video is about. So in this video, we'll talk about the benefits of digital health, and we'll examine the World Health Organization's statement of right to healthcare access. We'll examine the many barriers with insurance-based healthcare and that healthcare costs currently are absolutely unsustainable. We'll also learn that 80 to 90% of healthcare services are generally affordable, routine, office-based and outpatient services, and that direct pay is a very efficient and convenient way to save money on healthcare. So what's the statement that the World Health Organization made about healthcare access? So the World Health Organization, or WHO, states that everyone has the right to access healthcare. So everyone has the right to access healthcare, but what is the reality of healthcare access? So the reality of healthcare access is that the health insurance industry controls virtually all healthcare pricing, access, and delivery. And in order to do that, they've created many self-serving barriers, confusing contracts, opaque pricing, complex rules, administrative burdens, and surprise bills, and so on and so on. So the reality is that healthcare access is very much controlled by barriers and restrictions. But how much of this healthcare actually needs all these barriers and restrictions? So the insurance industry makes a big deal about how everyone needs to be covered. However, about 80 to 90% of all healthcare services are routine office-based or outpatient and commonly generally affordable. Unlike most other insurance businesses, the health insurance business is about the only insurance that covers routine expenses. For example, your car insurance doesn't cover the cost of a new tire. As well, the rationale for having insurance is to protect against significant unanticipated economic losses and not to cover routine expenses. So let's look at some of the claims made by the health insurance business. Remember, that industry is financially driven to make money. So in contrast to the many claims made by the health insurance industry about the benefits of having health insurance, in reality, health insurance has failed to control healthcare costs. It's failed to improve overall health. Just look at the ballooning obesity rate in the US. Most consumers pay more in health premiums than they get back in services. No wonder these companies are making billions in profit each year, because most people are overinsured. Most consumers never meet their deductible, and there's no irrefutable and reproducible scientific evidence that annual checkups and wellness plans provide any benefit. I'll include links to these articles in the description below. Another common claim made by the health insurance industry is that it prevents you from going into medical debt. Let's check this claim out a little more. So medical debt happens whether you are insured or not. whether you have inadequate insurance, subpar insurance, a high deductible plan, or are part of a cost-sharing scheme. Why? Because the health insurance industry controls virtually all healthcare pricing, healthcare access, and healthcare delivery. There are no market forces in healthcare. As well, insurances can tip you into debt by denying care or withholding payment for care after it's been delivered. So let's dig a little bit deeper and try to figure out why the health insurance industry has caused so many problems in healthcare. So it's been determined that the root cause of all the healthcare problems in the US is the coverage of routine healthcare services by the health insurance industry. And that's because 80 to 90% of all healthcare services are considered routine. The health insurance industry has created complex rules, eliminated choice and market forces, and eliminated value-based healthcare by all these restrictions and barriers to healthcare access. So most insurances have you pay for routine expenses. So how would that work in the healthcare business if you had to pay for routine expenses such as office visits? So cash pay healthcare is perfectly legal whether you have a health plan or not. You can choose to pay in cash and hold back your health plan, and it's ideal for the 80 to 90% of all healthcare services since most people never meet their deductible. It's cost transparent, it eliminates confusing contracts, complex rules, inefficiencies, redundancies, and surprise expenses. And it may favor you with priority access for your appointments instead of waiting weeks and weeks with referrals and authorizations. So how can consumers, employers, and physicians capitalize on a cash pay system for routine healthcare services? The answer is a digital health platform, and it has many benefits. It can revolutionize healthcare by improving access to 80 to 90% of all healthcare services, avoid the complicated rules, inefficiencies, redundancies, expenses, and injustices of insurance-based healthcare for routine care services. It can empower patients with consumer-directed care, championing cost transparency, efficiency, and convenience, enabling market forces and free market healthcare, and ensure that you are never overinsured. It can galvanize physician and provider autonomy, facilitate value-based healthcare, combat medical fraud, and deliver a far better customer experience. Even better, it's useful not only for primary care, but also for all specialist care physicians and employers and providers so they can connect directly on a smart device. So how can most healthcare be accessed on a smart device? Let's check that out a little bit more. So the digital health platform can revolutionize healthcare by removing the many barriers and inefficiencies to the access and delivery of 80 to 90% of all healthcare services. All sorts of apps could be integrated in an easy-to-navigate book and pay platform that allows consumers and employees to connect directly with physicians and providers through a smart device. In addition, dashboards for employers and providers can streamline administrative tasks. So in this video about digital health, you learned that 80 to 90% of all healthcare services are office-based or outpatient, that users can connect through a smart device in an easy-to-navigate book and pay system, that the costs for services are transparent, that the platform is highly efficient and convenient. To learn about other routine medical conditions, self-care, and digital health, check out some of these other videos.